friends everywhere. Today I will speak about an important clinical issue, which is intravenous fluid administration in clinical practice. Intravenous fluid administration and management of fluid and electrolyte balance are closely linked concepts in clinical practice. Any good clinician who is in charge of a patient who presents in the ER, that is the emergency room or the emergency department, and also in the medical wards and surgical wards, that is inpatient department in hospitals and in big medical facilities, should know and understand how to deal with the issue of intravenous fluid administration or intravenous fluid resuscitation. Because, as I mentioned, this is closely linked with the issue of proper management of fluids and electrolytes in the human body. Because, as we all know, water and electrolytes form a big proportion or a major proportion of human anatomy or the human body. As we all know that water is 70% of the human body weight, and the majority of this water is inside the cells. We call it the intracellular compartment or the intracellular fluid, and the lesser amount in the extracellular compartment, or we call it the extracellular water or extracellular fluid, and the majority of this is inside the blood vessels, and we call it the intravascular volume, which is formed of the blood, which is plasma and cellular elements, and the plasma contains molecules and proteins, including albumin and globulins and bind proteins and these things which carry the hormones inside the blood, and they act as carriers or as binding molecules which help in the transport of different substances inside the plasma, being the major component of the blood. And the rest of the fluid, which is in the extracellular compartment apart from the blood, is in the interstitial compartment. And then we have what we call the third compartment, which is the transcellular fluid. This is in short, the fluid and its distribution inside the human body. And in these fluids, especially the intracellular water and the extracellular water, we have electrolytes which should be in balance with each other. And we all know that the major extracellular cation is sodium, and the major intracellular cation is potassium. And we have also anions, which are very important, and the major inside the cells is proteins, as we all know. And then we have outside the chloride and the bicarbonate. So this is the distribution of the cations and anions between the intracellular and the extracellular compartments of body fluids. These electrolytes, which are mainly the sodium and potassium, in addition to the calcium and the phosphate or phosphorus, and the bicarbonate and the chloride, should be in balance with each other. Any disturbance in these electrolytes, especially in sodium and potassium, can cause major disturbances in the physiology of the human body because of disturbances in the biochemical processes and the body metabolism. So when we manage any patient in any clinical situation, especially critically ill patients and the acute cases, we should know how to manage the fluid and electrolyte, that is the water and electrolyte balance in such patients in every case individually, because in each individual condition or in each individual case there is a specific fluid and electrolyte disturbances, which is not the same in the other patients or in the other cases. So the good clinician or the skillful clinician should know how to manage fluids and electrolytes, that is water and electrolytes, that is sodium and potassium, together with calcium and phosphorus homeostasis, in order to keep the homeostasis of these cations and anions, and to keep these electrolytes in or within its physiological range without disturbances, which, as I mentioned, if disturbed, they will affect the body functions. They will affect the different systems, especially the cardiovascular system and the nervous system, in addition to, of course, its effects on other systems of the body if they are not kept in balance. I mean the electrolytes. So when we give intravenous fluids to any patient, it is guided by principles. It's guided by principles, and the intravenous fluid administration in every particular case, in every individual case, is a science and an art. Is a science and an art. A science because it is guided by knowledge. It is guided by basics and the principles of intravenous fluid administration or intravenous fluid resuscitation. And it is an art because it is guided by also experience which will guide the physician about the details of every case, because there are general rules which guide the fluid administration or fluid resuscitation, and there are, which should be applied to all patients, and there are specific guidelines which guide every particular case separately. And this is part of the concept of individualized treatment or personalized treatment or targeted therapy, that is tailoring the fluid according to this particular case which is presenting to you, which might be, and of course it is different from other individual cases or other individual patients. So there are general rules and there are specific rules, or more specific rules which guide the every particular patient, in addition to the general rules which guide all patients in whom we administer or to whom we administer intravenous fluids. Not only this, the intravenous fluid administration has to be guided with knowledge and with expertise that is according to the rules of clinical knowledge of fluid administration, and that is the science, and also by the art, because as we all know, medicine and the medical profession is a science and an art. And since intravenous fluids is part of the clinical medicine and the clinical practice, it is also guided by the same rules. It is a science and an art. يعني هذا هو علم وفن كيف تعطي intravenous fluids للمرضى, to patients, especially in critical situations and in emergency situations. That is why they are more commonly met with in acute medicine. That is, to be more precise, patients who are hospitalized and managed in the emergency room and in the ICU, the intensive care units, and in the critical care units, and in the surgical wards, and even also in the medical wards in patients. And sometimes also in the OPD, that is in the outpatient department, if there is a room, or what we call a treatment room, inside which we can decide, or the clinician in the ER or in the OPD can decide to give some sort of first aid intravenous fluid therapy, especially in patients who are acutely ill or subacutely ill. In chronic cases which doesn't have any acute or subacute problem, we don't need to give intravenous fluids to such patients. So this type of, or this category of patients is out of my talk. Again, intravenous fluid therapy is linked with fluid and electrolytes, and also linked with what we call the acid-base management, and keeping the acid-base status of the body within the normal limits, the pH of the blood to keep it within the normal limits, and so the pH of the cells to keep it within the normal limits, and to avoid extreme disturbances in the pH of the blood, that is to avoid the states of acidosis or the states of alkalosis, whether metabolic or respiratory. This is also linked to intravenous fluid administration, because the intravenous fluids with its water and electrolyte components, they are in interaction with the acid-base status, that is the balance of the bicarb with the oxygen and the carbon dioxide in the body fluid, especially in the blood. So proper management of fluid and electrolytes is linked with proper management of acid-base status of the human body, in order to keep what we call the homeostasis of the body within the normal limits or constant. Because as we all know, homeostasis is keeping the internal milieu of the body within normal limits without any disturbances, to avoid states of acidosis and states of alkalosis which affect the body functions by its two categories, the metabolic and respiratory acidosis, and on the other hand, the metabolic and respiratory alkalosis. So this state of acid and acid-base balance management is linked to the intravenous fluid management. That's why it's very essential to remember these concepts all together. That is, the proper fluid and electrolyte management is linked with proper acid-base management, and these two are affected or are closely linked with the proper intravenous fluid administration. And the clinician, when administer intravenous fluids, should know that by this intravenous fluid administration formula or decision, he or she will affect the fluid and electrolyte management, and at the same time will affect the acid-base management. So by your intravenous fluid clinical decision, you are managing or you will affect the management of إدارة الفluid والelectrolyte balance في البody, and at the same time acid-base balance, because as I mentioned, they interact together. So the intravenous fluid administration، لما بنديسايد الانترافينوس fluid administration زي ما قلت طبقا للنولج، الميديكال نولج زي ما بيقول الكتاب، وطبقا للارت اوف براكتس زي ما بتقول الخبره، وزي ما بيقول البراكتس، وزي ما بيقول اكسبيرينس، عشان هو الاكسبيرينس اللي لينكد ويز ذا ارت، وهو النولج او الساينس اللي لينكد ويز ذا ساينس. لان زي ما قلت هو خليط من الاثنين. كيف تعطي المريض انترافينوس فلويد، دي اللي هي يحكمها العلم والفن في الممارسه الاكلينيكيه. طيب، يعني هناك ديتيلز في كل كيس على حده، مش كل كيس بتاخد نفس الفلويد وبنفس الريت وبنفس الفلسفي، بنفس الفلسفه. بمعنى ان انت when you decide to give intravenous fluid لاني acute medical case، سواء كان في الطوارئ في الامرجنسي روم، او كان في الرعايه المركزه، او كان في الميديكال وورد في العنابر الداخليه للمرضى الخاصه بالمرضى الامراض الباطنيه، او مرضى المشاكل الجراحيه اللي بنسميها السيرجيكال والميديكال ووردز، او حتى في البيدياتريك ووردز، او حتى في الووردز اوف جاينيكولوجي اند اوبستاتريكس، بنديسايد ان احنا ندي intravenous fluid. الانترافينوس فلويد given in any of these departments اللي انا ذكرتها في اي مستشفى، يعني في اي medical facility، في اي مكان بيعالج فيه مرضى. This is how to give intravenous fluid. We should answer 3 questions. Why we give the fluid, number 2 why we give the fluid, when to give the fluid، اول حاجه امتى تدي الفلويد، وبعدين دي اسمها when to give the intravenous fluid، وبعدين why we give the interfluid، ده السؤال التاني، ليه هندي هذا الفلويد. يبقى لازم تكون جاهز انت the clinician should answer to himself these questions before answering to his colleagues or to his boss to his senior colleague in the hospital. You should answer these questions. When we give the IV fluids, why we give the IV fluid, and how to give the IV fluid, and what to give IV fluid. يبقى لازم تجاوب انت امتى هتدي، ليه هتدي، ازاي هتدي، وطريقة استخدام، وهتدي ايه بالظبط. ادي الاربع اسئلة اللي احنا لازم نجاوب عليها قبل ما ندخل فلويد جوه العيان ونحطها له نديله محاليل كده زي ما بنقول in Arabic in short. When we administer, when to give intravenous fluid, why you give the intravenous fluid, what to give as an intravenous fluid, what to give, which fluid to give, and how to give. Yani, what is the rate of infusion, and for how long are you going to give this infusion, and how will you use these intravenous fluids interchangeably. That is, مثلا we start with intravenous saline and then we continue with dextrose normal saline, or we continue with dextrose. This is the procedure of how will we interchange with fluids during the clinical course of clinical management, especially in acute situations. This is called the intravenous fluid resuscitation or intravenous fluid therapy. كل الأسئلة دي لازم تجاوب عليها قبل ما تحط الانترافينوس فلويد للعيان، لأن احنا زي ما بيعمل بعض الناس it's not given haphazardly. It's not given haphazardly and it's not given without rules زي ما بيعمل بعض الفيزيشنز في البور situations أو في البور ميديكال فاسيلتيز، إن هم بيدوا انترافينوس فلويدز وخلاص بأي طريقة وبدون فلسفة واضحة وبدون indication واضحة. So why you give, what are the indications؟ في indications, medical indications, clinical indications to give intravenous fluids. في clinical indications امتى ندي normal saline وامتى ندي half normal saline وامتى ندي when to give hypertonic saline and when to give crystalloids and when to give dextrose based and when to give saline based and when to give balanced based and when to give colloids like administering plasma or intravenous albumin, or even when you give blood, these are called the colloids. So when to give? Are you going to give a crystalloid, or are you going to give a colloid, or mixture of both? And if you are giving crystalloid, which crystalloid? Are you going to give saline-based, like all types of saline, or you are going to give dextrose-based, that's glucose-based intravenous fluids, like D5 saline, D5 in water, D50 water, D10 water, D20 water, whatever, all types. And when you give the saline-based or dextrose-based, which concentration are you going to give? These questions should all be answered, please. This is in general my reminder lecture today, and I will give next another lecture about the details of what I mentioned. Professor Dr. Tarek Ali.